Next, I want to talk about Trump coming out and putting out his new campaign promise. This is just a wild thing.
Interesting decision.
Interesting decision, right? It's like, why would you do this? What is going through your fucking head? So Trump is coming out and saying he wants to kill Obamacare. We have been down this road so many times. How long have we been hearing Republicans say repeal and replace about Obamacare? Trump comes into office in 2017 or 2018, around there. They put up the bill to eliminate Obamacare, and it fails. The Republicans in the House don't get it done. The Republicans in the Senate don't get it done. It's not. Trump already failed to repeal and replace Obamacare. The Republicans ran on that for a decade, and they failed to do it. Now he wants to dig up this old issue and bring it back. He said that the cost of Obamacare is out of control, plus it's not good health care. I'm seriously looking at alternatives. We had a couple of Republican senators who campaigned for 6 years against it and then raised their hands not to terminate it. It was a low point for the Republican Party, but we should never give up. But what kills me is he will never say the alternative. He will never say the alternative.
Yeah.
When he was running for office in 2020, there was a famous interview with Chris Wallace. And Chris Wallace straight up asks him, like, what's your plan for healthcare? He's like, I will give you a healthcare plan in 2 weeks. Okay, we are T minus,
6 years?
6 years
7
past
years.
that point.
Yeah.
So please, give us your healthcare plan, Donald Trump. Let us in on it. Because if we just go through with what you want to do, which is repeal Obamacare, here's the damages. 20 million people in the United States will lose coverage, raising the non-elderly uninsured rate by more than 7%. 135 million Americans with pre-existing conditions could face discrimination. Now, Trump will always say, I'm not against covering pre-existing conditions. Ron DeSantis will come out and say, I'm not against, protecting those with pre-existing conditions. Well, if you repeal all of Obamacare, that's what you get. If you don't have an alternative ready to go that you're not proposing, that you're not showing me, and all you're going out there saying you need to repeal Obamacare, this is what you're telling me you want to do right now until you give me your alternative.
Yeah.
Okay? States would lose $135 billion in federal funding for these marketplaces, Medicaid, and the Children's Health Insurance Program. So the entire Medicaid expansion is being put at risk if Obamacare gets repealed. Medicaid, guys, this is what gets health care to those who are impoverished. Children's Health Insurance Program, this is helping children whose parents don't have any health insurance that can't roll them in on it.
Yeah.
This is federal subsidies for marketplaces. We always say, Trump always says Obamacare is too expensive. Well, these federal subsidies are designed to get people access to private health insurance plans that they otherwise couldn't afford. Well, if you want to get rid of these subsidies, then what is your plan here?
Yeah. I mean, to me, it seemed the implication is it's okay to just have some people be uninsured.
Right.
Yeah, but it's ridiculous because these are the kind of pathetic excuses we have for government health insurance for lack of a universal healthcare system.
Exactly. And
even those he wants to get rid of.
Right. Even those. So insurance companies would no longer be required to issue rebates when they overcharge Americans. That's a little obviously, listen, that and the pre-existing conditions ones, I'm sure any Republican bill will have it in there. But I don't know. The fact that he comes out and he doesn't specifically say that I want to protect those portions, how am I supposed to read that? Other than you want to just get rid of all of it. So obviously there are massive detriments to repealing Obamacare, and it's no longer popular to be against Obamacare. Obamacare's approval rating is basically the highest it has ever been, with 59% of people supporting the Affordable Care Act in 2023, with 40% of people not favoring the Affordable Care Act. This is because of results. This is because people felt the Medicaid expansion. This is because people felt the federal subsidies with their private health insurance market. This is because people who didn't have health care for so long finally do, and they know it's because of the Affordable Care Act. Without it, they would be without health insurance, period. End of story. Totally. So it's not popular to go and run and say, I want to make it harder for you to go to the doctor. Sorry, Trump. It's just not it. It's not just Trump who wants to totally revamp our health insurance programs. It's Republicans in the Senate, too. Tim Sheehy, who's running for Senate in Montana against John Tester, the main swing race in the U.S. Senate, he came out and he said, our hospitals have been built around federal healthcare subsidies. In my opinion, we need to return healthcare to pure privatization. what the hell does pure privatization mean? Does that mean a complete reduction of Medicare? Does that mean a decimation of Medicaid? Like, what does pure privatization mean? Does that mean a reduction of all regulations? Does that cover for pre-existing conditions? If we're talking about pure privatization, then you can't say I want federal regulations, because that's not pure privatization anymore. So what does that mean when he says that? Well, reporters pushed him on it, and he refused to specifically say whether or not Medicare or Medicaid should be ended. But his spokesperson did say this: Tim knows we must keep our commitment to every Montana senior to protect their Social Security and Medicare benefits. He believes our nation made a promise to our seniors, and we must keep that promise, full stop. That tells me he wants to cut Medicare for you and me and all the people who have the technology to watch the show, but he doesn't want to cut Medicare and Social Security for the people who are currently getting it.
Okay.
That's what it tells me.
Okay.
Why did he say seniors? Why couldn't he just say that the people of America are trusted with these benefits? He says seniors specifically. That's a Nikki Haley comment.
I suppose. I think that could be fair. I also think it's possible that that statement is complete bullshit.
Right.
Yeah, right. Like, I think this sounds so, like, politicking to me.
Yes.
Like I don't trust that he will do either of these things, or
Right.
vote for either of these things.
Yes.
Yeah.
It blows my mind that, I mean, look, if you're under the age of 35, the Republican Party fucking doesn't give a shit about you. They don't want you to have Social Security when you retire. Or if they do, they want you to retire at 72. All right. Yeah. They want your Medicare benefits to be reduced. They want you to have to pay more for Medicare Advantage. They want you to not be able to be on your parents' health care insurance until you're 26. They are against the youth in every possible fundamental way here. There's just no reason to support their policies. They're not meant for you at all. So now he goes on. Tim Sheehy, apparently coming out of the 19th century, he says healthcare worked before health insurance even existed. Each town had a doctor that would drive to your house, take care of you, and then you'd pay him. And guess what? It worked. It worked when you actually paid a doctor for the services they provided. And then we started getting this health insurance stuff involved and these mega conglomerates. He's suggesting that could still work, which is like, what's going on right now? Yeah. Is this like a joke? Do you expect them to come in a fucking horse and buggy?
No, yeah. Like, he's talking about a time when our population was like less than a third of what it is now.
Well, less than a third, and we had more doctors per person.
Yes.
Our per capita doctor rate is down and only decreasing.
Yes.
Grown-ups who are in the U.S. government, who are in the Senate, who are in the Health and Human Services, Bernie is even working with other Republicans to get on this, expanding telemedicine, expanding access to seeing a doctor over the phone, right? Getting prescriptions over a webcam, seeing small checkup, stuff like that. That is the future of medicine. The very, very quick interactions, the expansion of physician assistants, of nurse practitioners, not doctors driving to your fucking house.
Yeah. And also you didn't have x-rays or MRI machines, right? Or like robots doing surgery on you. Things got more expensive because things got a lot better.
Yes.
But also, I mean, to be clear, we did a deep dive on healthcare. And one of the things we talked about is that the mega conglomerate structure of hospitals is enormously responsible for the high costs that we endure here in the U.S. for healthcare.
Absolutely.
But he doesn't seem to be implying here that he's going to dismantle that. Like he's implying that it's bad, but to say that you'll just have doctors driving to people's houses, that doesn't make much sense to me.
And when he says that he's explicitly against health insurance, right? Healthcare worked before health insurance existed. What? Like, it worked really badly because only the people who could directly afford to pay a doctor out of pocket saw a doctor.
Exactly.
So when you say it worked for who?
Yes.
It didn't work for the working class.
That's the thing. It's just regressing our expectations for the quality of care that we can provide to people.
Yeah, exactly. And so this is the type of people who are running for the U.S. Senate, guys. People who want to get rid of Obamacare, privatize our entire health insurance system. Literally says it. He wants to return it to pure privatization. Can't get more explicit than that. So donate to John Tester. Please, God. Because, John Tester may be a conservative Democrat, but he's way the hell better than whatever this is, man. This is just ridiculous. Obviously, the guy's a CEO of like an aerospace company, by the way. Tim Sheehy.
Okay.
Also a veteran, so thank him for his service. But
But fuck you.
yeah, but fuck you, man. God, you suck.
No.